We have time for questions now. Please introduce yourself and try to be as concise as possible. So, if you have questions. Okay, we have a question down there. Could you please wait for the microphone? Can we have a microphone down here, please?
Thank you very much. Can you all hear me?
Yeah.
Good. My name is Peter Mittler. I'm a person living with dementia, but I also am a researcher, an activist, a volunteer, a self-advocate for people with intellectual disabilities. That's been my whole life work. Since 2006, I've come into the Alzheimer's world as a result of my diagnosis. And the area that I'm still researching and really although I say so modestly, I know more about probably than anyone in this room, is the United Nations Convention on the Rights of Persons with Disabilities. What I don't understand, and maybe somebody can explain because it may be my dementia, the dementia world is not very knowledgeable, and that is being polite, about the United Nations Convention. I've no time to talk about it here, but this is a convention that comes close to what Mark Pearson has been talking about. It spells out for all countries of the world, and not just OECD, exactly what needs to be done to improve the quality of life of persons with disabilities in all countries of the world. People with dementia have legal access to this convention, but no one has used it. Not a single Alzheimer's disease association in the world has submitted, as is its right to do, a proposal or a submission to the committee that monitors this convention, which is the CRPD Committee of the United Nations Human Rights Bodies. They are waiting for such an approach. There is now some discussion. We're on the verge of this. So some of the people in this room know what I'm talking about and are converted. But the point I want to emphasize to Europe today is that there are things that Europe can do tomorrow without significant cost to find out about the convention and how you can use it. Europe has used it very well for all other disabilities, but dementia is not at the table. So the first suggestion is that Alzheimer Europe join the European Federation of Disabled People. It can do that. It is based in Luxembourg, of all places, and there needs to be dialogue, and Alzheimer Europe deserves a seat at that table. Before we leave this conference, the United Nations will issue a report on the EU's implementation of that convention, and it will be a very critical report. We will see it in a few days' time on the web. But the best evidence to that committee was given by the European Federation of Disabled Persons. So I think we ought to be at that table. The second part of that is that all the Alzheimer associations can also join the European Federation as associates. So you all have a voice. 16 European countries are about to be examined by the UN committee in the next 2 years. The UK is one of the first. We're not going to get a very good report for disability, although we're doing very well on dementia. And the third thing is that every country in Europe has an independent Human Rights Commission for all areas of discrimination. And they too write reports on what is happening about the implementation of the Disability Convention. Northern Ireland has done so. I hope Scotland will do so, because Scotland is ahead of any other country in the world, as far as I'm concerned, in terms of using the convention to plan its own policies and influence its own government. And I congratulate the Scots on this initiative, and I wish all countries were at least where they are when they are working to move forward. So there's plenty to do.
Thank you very much. And I'm pretty sure there are people here who would like to comment on that. Sorry, we have Sabine here and then Mark. Okay, Mark first. You can. Yeah.
Yeah, I'm Mark Wortman from Alzheimer's Disease International, and I'm glad to pick it up for the world level and talk to the Commission of the UN. We will certainly do that. So Peter has convinced me. And if I have the opportunity, can I ask Jeff Huggins, you said this is a European project, but we want to make global connections as well. Is that possible? And could ADI play a role there?
Okay. In terms of how the joint action operates, most of the rules relate to how we can spend money and who we can take money from. So that, and within that context, it means that we are able to engage with a wider group of partners as long as they don't pay us and we don't pay them. And so that's the way in which we've been trying to take the conversation forward. So we've had some conversation with colleagues in Korea and Japan, again, partly building out of our existing networks, but thinking about how we can build on the expertise that comes from other countries, because the objective in this space is to learn and to develop learning communities. One of the stories which I sometimes tell comes out of the visit which I had to Tokyo last year, which was really very interesting in so many ways. But over a 2.5-day period, one of the things which I reflected on was so many people talked about the work that had happened in Scotland around diagnosis. So many people commented favourably on it. But over 2.5 days, nobody asked me how we did it. And it was a really interesting component to the event. So people saw this as a major challenge for their countries, but at this, in terms of the behavioural, in terms of how we learn from each other, we weren't yet in that space of looking to learn and share. And we have taken so much of what we've done in Scotland from other places. We've just run with it when we found it. And so the learning component, and that's why I guess an event like this is really valuable, is really important, in that you have to take the knowledge and you have to make it work for you. So we'll look to do that with a wider range of partners, although we cannot pay them money and they cannot pay us money.
Yeah, Sabine, please.
Yeah, my name is Sabine Jansen from the German Alzheimer Association. I just want to give a short comment to Peter's speech. And I can tell you for Germany that we are aware of the UN Convention, and we are a member of the Alliance of Civil Organizations, and we commented on the report. We did it's called Shadow Report to the State Report, and we put the theme of dementia on the agenda of this. Maybe other society associations in Europe do the same, but maybe it's not known everywhere.
Thank you. We have a question up there. Yeah, I guess.
I came from a long journey. Hi, I'm Agnes from Alzheimer's. It's the Scottish Dementia Working Group and also the European Working Group. When I'm speaking at the moment, I'm putting a Scottish hat on, and I wanted to say that anything we do in Scotland to do with dementia, we look and base it on human rights and the rights of people with the disability. So maybe that's why Scotland hasn't made a move, is because we just assume everyone does the same thing. So we come from a human rights-based country first and foremost. Thank you.
Thank you. Yeah.
Good morning, everyone. My name's Archie Latta. I'm a member of the Scottish...
Could you please stand up so that we can see you?
My name's Archie Latta. I'm a member of the Scottish Dementia Working Group. I have been for about a couple of years now. I can't really remember. But the importance, I think, about dementia is we have a saying in Scotland, nothing about us without us. So when you're involving people with dementia, you've got to be in touch with us as well, because we're the people that is living with this illness. And there's a difference from living with the illness and talking about it. And even all the intellectual, nothing against you, but you don't have to live with the illness. It's only the people that live with this illness and experience it can, you know, there's changes happening all the time. My head has been changing again, even just since I came on holiday there. And that's how you actually, and it's actually someone experiencing living with this illness. That are the people you've got to talk to and try and understand. That's really all I like to say. Thank you very much.
Yeah, there's one in the middle. All right.
My name is Magda
Magda
Tsolaki.
from Greece.
I'm professor of neurology in Greece and chair of Greek Federation of Alzheimer Association in Greece. I have two questions. The first one is to Geoff. How can you have results for these very interesting questions you have to answer if you have in different work packages for each country? For example, in every work package, you have included different countries. So you will have no answers for every target question in order to have answers globally for Europe. And the second question is to last speaker. How do you think that is the best way in order to have answers in all these questions you have put on the table? Are you going to use the publishments, the papers? Are you going to ask questionnaires to different ministers of health? Are you going to come in contact with Alzheimer Association in different countries? How are you going to succeed all these big targets you have prepared and presented today to us? Thank you.
Okay. I think the experience from a number of the joint actions, and Scotland was also involved in the previous joint action on mental health, is that the coordination and the work becomes quite challenging once you move beyond 5 or 6 countries being involved in a particular work package. And so what the intention is that it allows those countries to have a focus on a particular component of work, but then the dissemination strategy becomes the mechanism by which we talk to the other countries. And we've been, what we've also looked to do in constructing the membership of the different work packages is to ensure that if possible, the countries are at different stages of development in taking forward dementia strategies and policies. So France has done a lot of work over many years and is involved in a couple of the work packages, but countries from more in the east and in the south of Europe have become involved as well. And it means that as those healthcare systems are also quite different, it enables you to actually work through the challenges and propositions in the different types of jurisdiction, in the different contexts. It simply wouldn't be manageable for us to bring together 20 or 30 countries in each of the 4 or 5 work packages. And the experience, I think, of the mental health work, where there's been 15 or 16 countries across 6 or 7 work packages, is that actually taking it to a conclusion and taking it to results has been quite. So it's really just being pragmatic, and I think pragmatism is really important there.
And I. Is that on? Yes, good. And I will say the same. Yes, pragmatism is the only way to make progress in an area like this. So in terms of those big targets that we were talking about, I did say there were 2 different sorts. The early wins that we might aim at and the longer term objectives. The early wins, yes, we go and ask the health ministries and the social ministries of countries to provide information on what they're doing and what information that they actually have. We don't just take their word for it. We then have something called a process of peer review, whereby other countries are able to ask the countries that provided the information. They say, hang on, you say that, but does that really make sense? Is that really comparable with the way that we do the measures? You say you have this policy, do you actually implement it on the ground? And so this method of peer review brings up whether the policies are actually meaningful and whether the information provided is meaningful. And that's really, I suppose, the OECD's role as an intergovernmental organisation to try and help countries learn from one another. In terms of the longer-term objective of trying to get information on the actual outcomes, particularly for people with dementia, I mean, what you're saying, I mean, all this talk about talking to people with dementia when you're talking about dementia policies is absolutely right. And of course, that's exactly what is really missing from nearly all statistical systems at the moment. I think the way forward will be to talk about the horrible acronym of PROMS, patient-reported outcome measures, which is a horrible way of referring to these things, but it's basically saying talk to people with the disease to actually get their assessment of whether the treatment they're getting is actually improving their status, their lives at all. For the dementia in particular, I think that is the direction that we'll need to go around for a lot of other diseases too, but we're not there yet. It's more a question of developing the tools so that we can actually collect that information in a comparable way across countries.
Maybe just add to a few thoughts to that. Since the end of last year, we've been doing some work with ICHOM, who do work on health outcome measures more generally, and a number of other countries to develop patient-focused, person-focused outcome measures. And you know, that process is working its way towards a pilot probably in the autumn of this year, and increasingly beginning to focus on measures of well-being, and experience, because when people talk to us, they talk about wanting to do the things that they like to do with the people they like to be with in the places they like to be, and none of that appears in any of our health data. So we're beginning to get into that space, although I think it's still quite complex. I guess the other challenges I think we have, and Simon Lovestone's presentation this morning was really inspirational in many ways, but I guess the question is, if you're beginning to create that routine data which enables you to do different sorts of research and improve quality of care, you should be building in outcome measures as part of that story. Because over time, you want to be evaluating different treatments and interventions as much against people's experience of benefit as against the degree to which it saves healthcare systems money. Because those two things are quite different things. So I think there's a question as to whether, as these platforms develop, and they will across the world, involving millions of people, the degree to which they begin to build this sort of data in. And the third point, I think, is we need this data in real time. We don't need this data in a 5-year or an annual report, which is using data which is 2 years out of date. We are running health and care systems which require us to know today what the experience of people in our systems is, not what it was 2 years ago. Because with the speed of change in health and care and the challenges and the demands, this is the system that we're working with. And in 2 years' time, the system will be different again. So the challenge here is to get beyond, and holding governments to account is an important component of this. But this understanding of how people experience the system has to become part of how systems are run and operated.
Yeah, thank you very much. Okay, maybe I can have the pleasure of asking the last question. And I see so many people with dementia here, and it is so encouraging. So my question is to people with dementia who are in this room, and also to Alf. What advice would you give us, scientists and researchers in this field?
Scottish Dementia Working Group. This isn't rocket science. You're putting out, we need to be in at the very beginning of the pieces of work you're involved in, not just dropped in as and when you want us to be involved in. So you have to have a voice. We don't have time. So crack on with it, please.
Helga, I'm sure you would add some of your comments too.
Just a short comment, as all my friends said, and I think it is amazing to see that, referring to the questions, more people with dementia acted than you. But as we all want, and this is our aim, include us from the very beginning. Include us together with our carer. Give us a voice, but not just theoretical. Let us sit in a panel, partners on the same level, because we are able, and it is also an ethic responsibility to include us. Thank you so much.
So, thank you very much. That will bring us to the end of the session.